a lot of them grew up feeling like they didn't really fit in for
Mhm.
whatever reason. Many of them were called tomboys or effeminate boys growing up.
Mhm.
Um, and it just something about like seeing these other kids my age just going through this and starting out as these awkward kids who some of them were in really bad situations. They were being abused at home.
Yeah,
They're being
bullied at
bullied really hard at
school.
school.
I was
Which
bullied.
I
Yeah.
was bullied. I was totally
Yeah.
bullied.
Totally, me too. Yeah.
Um, and they seemed to find this sense of happiness and wholeness, and they seemed to shine even brighter as they like talked about like discovering their identity and finding affirmation and cutting their hair short and dressing more like the opposite sex and
Mhm.
people approving of this and calling them by their preferred names and pronouns and everything. And eventually many of them went on to undergo like different medical procedures like the hormones or the surgeries.
What are the names of some of these hormones?
um well, for me, I went on a drug. I ended up going on a drug called Lupron, which I don't know if you're familiar with it.
I've read about
It's
Lupron.
it's
Yeah.
so it's
It's a
been
hu
used as like a cancer drug
Mhm.
for usually for like late stage reproductive cancers, I think, and for conditions like endometriosis.
Mhm.
Um, but it's also been used as a chemical castration agent,
For
and they
women.
for no chemical castration agent
For
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 sex
sex
offenders of
offenders.
children. But they
Oh,
stopped a lot of facilities have stopped using this drug to castrate those sex offenders because it's been deemed too cruel for use in that population,
mhm.
which is very interesting because we're using it on perfectly healthy children like me. Um,
Wow.
I also about a month later went on testosterone. Um,
Wow.
it was I think it was testosterone cypionate, so it was in like a I think like an injectable gel, and I took it intramuscularly, pretty much weekly.
Mhm.
And the final intervention that I had was I had an elective double mastectomy to
Oh,
surgically remove my breasts.
yeah.
And this was not just any like cancer related mastectomy. This it's a modified version of that, which is even more invasive. It removes different parts of the tissue. Um, and they don't care as much about like reducing scarring. So you often see patients who have like big, massive
I've
scars.
seen some of the images. It's a
Yeah,
giant line.
yes. And in my case, I
Yeah.
had a type of incision called double incision with nipple grafts, meaning that they cut into each breast, but they also grafted the nipples. So they like took them back off.
Oh,
They took them off, and then the way that it was. So the surgeon described it to me, and they probably simplified it a little bit, even because I was 15 years old. I was a teenager at the time that I underwent this last procedure. They would like do like a controlled scrape on the chest, in an area so that they would reposition the areolas into a more masculine looking position.
oh,
And there's a lot of
yeah.
complications that are associated with
Of
this.
course.
A lot of
Yeah.
people will have their grafts just fall off within
Yeah.
the first few weeks or months. Thankfully, mine didn't. And for the most part, I've healed fairly well from the surgery, but I have had some complications.
Yeah. I mean, thank you for sharing that. I've seen the pictures, um, and I'm like, that doesn't look like what my friends got because I'm at
No,
that
it's
age
completely
now
different. It's radically
where
different.
my friends are getting mastectomies, double mastectomies because of breast cancer. And it's usually under the breast,
Mhm.
and they try to leave as much tissue as they can.
Uh-huh.
Um, but this is not that. I mean, what you've just described to me, I have never heard anything like that in my life.